Okay. Hopefully everyone can hear me okay. My name is Dr. Michelle Savigny, and thank you for joining me this afternoon to talk about how to get a leg up on our tripod rehab patients. First, before we start, just want to point out that my friend Izzy over here is going to be dealing with technical issues in the chat box. So if you're having any problems there, just type into the chat what your issues are. She will try to fix it for you. Any specific questions regarding my discussion, feel free to type those into the Q&A and we'll go over those at the end of the talk. Ooh, if I could advance. There we go. And before we get too far into things, I do want to thank our two sponsors, Adequin and the Response Systems. Adequin is, of course, a medication most of us are probably very familiar with. It is one of our most commonly prescribed drugs here, one of the top recommendations for any of my arthritis patients. Response Systems, they are also a wonderful company. They make the laser we use over here at Sound, as well as the Pemph or pulsed electromagnetic field beds that we utilize with our rehab patients. We will talk about both those a little bit later too. So just a quick word about me. Again, my name is Dr. Michelle Savigny. Initially graduated vet school from Texas A&M. And at that point, critical care was still my ambition in life and career. Went on to do an internship residency in emergency critical care at Auburn. Finished that, came up to Washington, and kind of bounced around the Southwest Washington, Puget Sound area, working in some different specialty practices as a criticalist for many, many years. And unfortunately, being a criticalist is kind of like this meme up here. Everything's on fire around you and you just need to convince yourself it's fine and get through the day. So that started to get a little tiresome. And then this stupidly handsome boy down here is Bricks. He came into my life a few years ago. His owners gave him up because he had really bad elbow dysplasia. And because of him, I actually became a client up here at Sound. Started to learn a little bit more about rehab and all the different fun things we can do to help our joint patients. So that kind of piqued an interest. And then this other adorable creature here, this is Willow. She is my newfie. You'll be seeing a lot of her today. In pictures, not in person, unfortunately. But she unfortunately was diagnosed with osteosarcoma in her right front leg a couple years ago. So we got a crash course in Big Dog Tripod. And she's kind of the reason why I decided to make the ultimate switch from critical care to rehab. Just kind of started to realize there's a little bit more we can do for these guys to help them live in their best lives. So now I work here at Sound. My life is much less stressful and a little bit more happiness, rainbows, and of course coffee, because everyone needs coffee. All right, quick overview of what we're talking about today. So just a quick blanket statement too. Today's talk is not meant to be an in-depth discussion on these things, just more a general overview. So we're not going to delve too deep into things. If there's anything anyone is interested in, wants more information, wants to chat more, my email's at the end. Feel free to reach out. I'd be happy to talk more in depth with y'all. So first off, we're going to talk about why tripods in rehab, besides obviously they are adorable patients and I'm a little biased, but maybe one of the best patients. We'll also talk about the different reasons that we have for amputating dogs' legs, things to consider before amputating that leg if we can, and what that amputation means for the dog and for the owner. Then, of course, talking about some general, very simple things that really anyone can do for these tripods to help support good quality of life. And then the basic when and if you need to refer these patients to Sound. All right, so why tripods? There's this notion, of course, that dogs do fine with 3 legs. We can do an amputation, they're great, they adjust, we don't need to do anything. Well, that is, yes, somewhat true, but we do have to ask ourselves a little bit, can we do better? And the resounding answer to that is Yes, we can. There's some simple different things we can do to help preserve that pain-free mobility in these guys for longer, again, with the goal of keeping them living their best lives for as long as possible. Going over reasons for amputation, and again, I'm going to point out, in case it wasn't evident yet, we're talking mostly about dogs today. Not that cats are not special tripod patients. Cats are very unique and special. They deserve their own talk. They're definitely a little too good to be grouped in with dogs. So just dogs today, guys, sorry. Getting back to reasons for amputation. Cancer, unfortunately, is by far the most common reason we talk about cutting a leg off. Osteosarcoma is the most common type of cancer we deal with. This X-ray image here, this was Willow's minute osteosarcoma in her radius. We do sometimes see some soft tissue sarcomas, mast cell tumors, other types of cancers. Otherwise, we do see a subset of patients that have had some sort of trauma, different fractures, soft tissue injuries that we can't afford to try to fix. They're not healing well. They're just too damaged to put the animal through it. So it's best to amputate the leg. Less common, we deal with things like bad infections, spider bites, ischemic damage, congenital deformities, kind of get grouped into the amputation category. And then the peripheral nerve injuries, most commonly the brachial plexus injuries. So if we're lucky enough to see this dog before the decision for amputation is made, there are some things to talk about before we cut the leg off. Number one, are there other musculoskeletal disease things present? Does this dog have two bone cruciates, lots of elbow arthritis, other things like that, that potentially could affect its ability to move around well enough on those three legs? Just because there is other musculoskeletal disease present does not mean that we cannot do amputation. It's just something we have to consider. We also need to look at the neurologic status of these patients. If we have an older German Shepherd who's having some signs of weakness in the back end, lumbosacral disease, anything like that, maybe not the best candidate for taking a front leg. But again, nothing is black and white. We just need to consider these things. One of the big things that I'd love to point out is the level of amputation that we're doing on these guys. You know, it used to be that we're taking a leg off, go as high as possible to avoid any potential injuries to the remaining stump on that animal. Well, things are changing, and we are starting to utilize more prosthetic or orthotic type devices. So this is a dog with a partial limb prosthetic here. And this is something that, again, we're starting to kind of appreciate more in vet med, to where if we can consider taking as low of an amputation as possible, that gives us as much of a residual limb left, so that if we wanted to explore the option of a prosthetic to help maintain some of that quadruped motion, we have that option. Unfortunately, we do need as much residual limb as possible. Typically, we're looking at least 50% of the anabrachium or the tibial part of the leg for a prosthetic to really be helpful for that animal. We could talk a lot about that. It's not what we're talking about today. So I'm going to cut myself off before I go further. Besides just to say level of amputation, if we're talking about cancer in the leg, that, of course, is a decision that needs to be weighed versus clean margins for the cancer, and should be a full care team with owners, regular vet, oncologist, all of that. And then we, of course, need to consider these guys' quality of life after surgery. One of the main reasons why we talk about amputating a leg is for pain relief, specifically in those osteosarc dogs. Is taking the leg off going to offer them that pain relief that we're looking for? We also need to consider that dog's activity level. Is this dog going to be able to still live a good quality of life if it has super active life and be happy with only having three legs? So then we go to, we're not just talking about the dog, we're also talking about the owners. And I know from experience that the decision to amputate a leg definitely can be stressful and come with a lot of guilt from that owner. And these are things we need to appreciate and kind of counsel our owners on. There's not a right or wrong. We can't have any judgments. Every case is individual. And again, considering the whole picture, not just what's wrong with the leg and how we can fix it. And if we can get the owner to accept that this is the best for their dog, we also need to work on owners' expectations after surgery, because oftentimes life after surgery for a tripod can be very different than life before surgery. This is especially true if we're talking about a dog that has cancer, is going to be on chemotherapy, radiation, anything like that. And then, of course, just because dogs can do certain things and they adjust, because they're dogs and they adjust, that's what they do, doesn't mean that they should be doing all the things that they want to do. So going on 10-mile hikes every weekend might not be in their best interest, even though they love it. And so kind of counseling the owner on maybe taking into consideration things in moderation just a little bit and figuring out what that dog's new normal is going to look like for them and kind of adjusting to what that is for the whole family. So moving on, more specifics about the dog itself and what losing a leg means to them. So fun little table, don't worry, I kept statistics and numbers and everything, hopefully to a little bit of a minimum for y'all. But here we have our normal 4-legged dog, regular dog, no other orthopedic issues. Those dogs put 60% of their weight on their front legs, which means 40% of the weight on the hind legs. So a dog normally puts a little bit more weight on the front, a little less on the back legs. When we take one of those front legs off, dog has to redistribute that weight. And that one front leg now, instead of being at the 30% for one leg, is all the way up at 47%. So that's a 17% increase in weight bearing on one leg. Have a little bit of redistribution to the hind legs. We're at 53% total, or basically a 7% increase for each hind leg. Now, the hind limb amputee, these guys, this is why we talk about how these guys can do a little bit better maybe, because they keep both the front legs where most of that weight bearing is. And by losing just the one back leg, we have a redistribution of weight that is a little bit more even. So we have only about a 6% increase in both front and then the one remaining hind leg. So one leg doesn't necessarily take the brunt of the missing leg, but we still have redistribution and things are not normal. Other changes we see with these guys from taking a leg away, we have increased forces going through these legs during just normal ambulation. This includes ground reactive forces, propulsion, braking type forces, and these forces, of course, go through the joints. Abnormal forces on a normal joint increase arthritis risk in that joint. We also have different angular changes to the legs, just from the nature of the change in center of gravity that these guys experience. So their stance changes, so how they stand, the angles those joints are in change a little bit. This is Willow demonstrating a rather poor tripod stance, but she exemplifies things. So that front leg's a little medial, a little bit farther back, and a little turned outwards. So she's definitely stressing those joints in a different way. Her back end, her hips are a little bit more flexed, stifle's a little bit more flexed, and she does have a little bit of a wider back leg stance to help stabilize her new center of gravity. The other thing these guys have that owners especially need to really be aware of is standing tolerance changes. Standing's hard work when you only have 3 legs instead of 4. And so it requires more effort, especially in the initial periods while dogs are still adjusting to their new status. They are going to spend less time standing, more time sitting or laying down. With the giant breed dogs like Willow, she didn't sit or stand around too much. She was mostly on the floor on her back anyway, looking for pets. So can't say I really noticed too much of a difference on her. So then what can we as a veterinary community do to help these guys? And the answer is, of course, there's a lot of things we can do. And this is kind of a breakdown of the different topics I go through, especially when I'm talking to owners about the different aspects of care that we can address and maybe make some changes in. And again, this is more of just kind of a general overview of things. I'm not getting into things too deeply. If you do have questions or want to know more about things, again, don't hesitate to reach out. I'm happy to discuss things more. But we're going to talk about different pain control, weight management, brief thing on supplements, joint protection, activity modifications, assistive devices, home environment modifications, and then of course, just a couple therapeutic exercises. So pain control first and foremost is my top priority for every single one of my patients. You can see my girl Willow here. This is right after her amputation surgery. Her surgeon and team did a great job of keeping her pain controlled. She is snoozing and super happy. And we want to make sure all of our patients are just as happy every day. And in order to effectively treat these signs of pain, we need to know what pain looks like. And the obvious yelping, screaming, not putting weight on a leg, limping, those things. But dogs, of course, are a little more subtle sometimes. And so we need to look for other little signs. Panting, restlessness, licking, changing in normal behaviors. If the dog normally greets you at the door and it's not doing that anymore, normally follows you around the house and they're staying on the bed kind of thing, those can be little subtle indications. The AHA site has come up with really nice little client handout that summarizes some of the different pain symptoms that we can see in our dogs. And I like giving this to owners because these are things owners don't often think about. So it's nice for them to have a reference to go back and kind of look at, and then look at their dog and say, yeah, I have noticed that Fluffy's been sleeping more. Maybe that means she is painful. So it's a way that we can help our owners help us take better care of their dogs. And then going back to this slide real quick, I always say if there's any concern that an animal could be painful, how I approach that is I err on the side of they're painful, let's go ahead and start some treatment for it. Give it 2 weeks, watch their response. Owners are always kind of surprised by this because we'll do this and then they come back or give me an update in a couple of weeks. I'm like, you would not believe how much energy Fluffy has now. She's running around the house and chasing the cat. Like, so turns out she probably was a little bit more painful than she thought. So that can be a great way, honestly, if it's unclear from our patients, is see what happens with the trial of drugs. Pain control. So when it comes to pain control, we have a lot of different options. And I really like using multimodal pain control. So basically a little bit of this, a little bit of that, combine some different things so that we can hit pain at different levels, different targets, and ideally more effectively control that pain and try to minimize some of the side effects we might see from the medications themselves. And this is just a quick list of some of the different medications we do have available that are used for pain. The NSAIDs, of course, everyone knows. Gabapentin's real common as well. You do have to be careful with GABA in the especially older dogs that maybe are a little bit weak, maybe haven't adjusted to their 3 legs yet. That's one I always err, again, kind of starting on the low side of the dose and maybe just twice a day, let their body adjust to it, and then kind of ramp up to 3 times a day, higher doses if needed kind of thing. The other important thing about gabapentin is with its pharmacology, pharmacokinetics, all that fun stuff, it is most effective if we give it 3 times a day. Depending on owner schedules, that might not always be possible. Twice a day, some dogs do okay with. Once a day, probably not super effective for pain control. I will use it once a day in some of my patients at night just so they can sleep a little bit better, but that's not necessarily a pain control tactic. Pregabalin, or Lyrica in the human world, is similar to GABA. It acts on the same receptors, just a little more specific for it. So actually can work a little bit better than GABA. That's one that if GABA's not really working or I can't use it because there's too much sedative side effects, a lot of times I'm starting to reach for the pregabalin now. It's kind of nice. You can do it twice a day, and it can be more effective at pain control than GABA, and it definitely has less of these sedative side effects that we see. Other pain medications, amantidine's a good one. That's one that I don't typically use as a sole agent. Amantadine works best with friends, so I usually add it on to one of the other medications based on the dog. Ketamine is another thing we are starting to use. There's a protocol for low dose sub-Q ketamine about once a month to help with chronic pain. So especially like the old arthritis dogs, things like that, LS dogs, that their oral medications aren't really cutting it. Sometimes the extra little oomph from that real low dose of ketamine can help. I've had kind of mixed experiences with it quite yet. Definitely don't think it hurts to give. It's pretty cheap. And if it helps, the owners will let you know. And other medications, amitriptyline's one that sometimes I reach for when our options are getting more limited. Then there's the codeine tramadol debate. We're not going to talk too much about that. Adequan's on here in parentheses. Adequan's not a true pain control drug, but because part of its actions are to help block the breakdown of cartilage in the joint, it therefore also helps to block the inflammation that causes, and therefore the pain that inflammation causes. So it's kind of this positive side effect that, especially the more moderate to severe arthritis guys, we start Adequan, we can actually get some pain relieving qualities within anywhere from 2 to 4 weeks. Kind of depends on the dog a little bit. Other modalities we use, ice and heat therapy, of course. Ice therapy, cold therapy can be great for more active inflammation and pain. For dogs that go for a walk or a little sore afterwards, applying ice after that activity can work well. There are some dogs that will absolutely not tolerate ice packs, but like the heat packs. And I have found that heat tends to work better for the muscle soreness too. It just kind of softens that muscle up a little bit better, and dogs tend to tolerate it better. So that's one. Heat, you never want to use, of course, in the acute inflammatory stage, so avoid it for the first 72 hours after an injury. But for more chronic stuff, we're talking about that, can be useful, especially if we're talking muscle strains, soreness, that kind of thing. But always listen to the dog and what they like and tolerate. It's never worth holding them down just so we can hold an ice pack on them for 20 minutes. Other modalities, Pemph therapy, pulsed electromagnetic field therapy, we talk more about in the next slide. Starting to really like that and using that a lot. Laser therapy, of course, is a wonderful tool. Acupuncture can be very helpful for pain management as an adjunct to a lot of these other things. Sometimes we can get down on medications, get them moving better, and using their muscles, building up muscle a little bit better. TENS is another thing that, depending on the source of the pain, especially if it's nerve pain, if we're having some phantom limb type pain, TENS can actually help a lot with that type of pain. And again, it's something the owners can do at home. And then there's, of course, just general massage, working out some of those muscle kinks, myofascial release. That's a whole other topic in itself. But Pemph therapy, so again, the pulsed electromagnetic field therapy. Pemph is way easier to say and spell. This is considered a non-pharmaceutical anti-inflammatory device. Basically, it helps treat pain and inflammation without having to give drugs. It also helps to promote healing. This is a great option for owners at home. There's kind of two main versions we use. One is the CC loop. This is just basically a 20 centimeter little loop that you put around an elbow, a knee, a neck, and turn the button, runs for 15 minutes, it's off. It's pretty nice, convenient, good for localized treatments. The downside is it does have a finite battery. Runs for about 150 uses, and then once the battery's gone, you have to basically toss that, get a new loop, but it can still be a very effective product in the meantime. The response system bed, So the bed itself is this thinner kind of tan bed under here. Ooh, wrong thing, sorry about that. That I just have the standard foam bed on top of it because my dogs are spoiled, ridiculous creatures and they like the cushy stuff. So the little bit of a bed on top of the thinner Pemph bed makes it more comfortable. And the Pemph bed itself, the nice part about this, so it's a pretty big thing. It's pretty much treating most of Willow right now. So we can treat multiple areas. It's great for the older geriatric dogs, areas where, or dogs that have more than one area where they're sore. It's easier than having to switch the loop around to 4 different spots. The other nice thing about the bed is they're rechargeable. We have a little battery pack up here that's flashing blue that plugs in, charges, and basically lasts forever. We utilize this bed pretty much for all of our rehab patients. When they come in, they do the treadmill, they go, they hang out on the bed and get lasered there. And they are pretty sturdy. So definitely recommend those guys. All of my dogs and my cats kind of fight over that bed when it's on. Treatment-wise, whether we're talking about the loop, whether we're talking about the bed for any Pemph therapy, typically we're talking a loading period, 2 to 4 treatments per day for about the first 2 weeks. Then ideally, if the dog's doing better, feeling a little bit better, we can go down to 1 to 2 times a day for a maintenance dose. If there's an acute flare-up or they're having a bad day, you can go up a little bit higher. There's nothing wrong with that. The other modality we use a lot of, especially in clinic here, is the laser. This is a great part of our multimodal therapy. So laser, photobiomodulation, light therapy acts at the cellular level, decreases pain, decreases inflammation, helps healing, a bunch of physics stuff we won't talk about. Basically does really good things to help these guys. We frequently will target specific sore joints. When we're doing that, we always want to remember not to forget the muscles around the joint that are going to be sore too. For the tripod specifically, I like using the laser for the areas of compensation, just to help, especially in the initial few weeks when they're adjusting and building up more stamina in those muscles. For Willow here, she is prone to having a sore neck. So she gets some laser treatments to her neck occasionally to help with that. Being the front leg amputee is pretty common for the neck to really have more stress. Just it's used more in propulsion to help them move. Other areas for amputees, basically lumbar LS areas, the corpus in either the front or the hind limb amputee can take a lot of stress. It's obviously the front leg amputee, that other carpus takes a lot of the brunt, but it has been shown too in a hind limb amputee that the front leg opposite the amputated leg takes a little bit more of the brunt than the other legs. And then the tarsus in the other hind limb if we have the hind limb amputee dog. Weight management. It's always a fun discussion with owners. Weight management is very important for any of our dogs for mobility, arthritis, but especially important for our tripods since they have to carry all that weight around on just 3 legs now. And when we're talking weight management, we're looking, basically we use the Purina BCS scoring with an ideal body weight of 4.5 to 5 out of 9. And the kind of convenient thing about the Purina system is that for every 1 point off ideal, that equals 10% of the animal's body weight that's either above or below. So basically, if a dog has a BCS of 6 out of 9, they're 10 to 15% overweight, which is useful when we're calculating to help them lose weight. Weight management is important. It's not just the extra strain that extra weight causes on the legs, but fat itself in the body is pro-inflammatory. So it causes more inflammation in the body as a whole. And so we want to try to minimize that fat if possible, and minimize the inflammatory state, which helps with arthritis control. I have different studies on this. Basically, the gist is Thinner dogs, more ideal BCS dogs, live longer, less likely to have OA. If they do develop OA, it requires treatment typically at a later time point versus counterparts. The other fun fact is different study, but looking at some overweight arthritic dogs, these dogs significantly improved in their lameness with losing just 6% of their body weight. Not getting down to ideal yet, just losing 6%. And to put into consideration, 75-pound dog, 6%, it's only 5 pounds. That's doable, should be doable for any of our patients. To help with weight loss, so weight loss itself is a combination of nutrition and exercise. Always get the excuse of, well, my dog's lame, it's not supposed to be doing exercise. Well, weight loss is 80% nutrition, 20% exercise, so it's not a full excuse. And working on that nutrition, typically the snacks, tends to be where we fail in some of these things. And when we're talking about weight loss to our clients, we need to give them specific goals. We can't just tell them, yep, Fluffy's overweight, she needs to lose some weight, good luck with it. We need to basically say, okay, she's overweight, she's about 15% overweight, which means she should be weighing this. And we can actually do a fun calculation of working out what the baseline RER calories are for her lean body weight. So to do that, RER in kilocals is their lean body weight, which again, we can estimate from the BCS, to the 0.7 power times 70. For those of us that don't like math, there's tables available. The CARE website, caninearthritis.org, I believe, has a great table that does all these calculations for you, super easy. If you can't find it, let me know, I can email that to you as well. But once we figure out what resting energy requirements are, we take 80% of that. And that's the diet calories for this dog. So that's the restricted calories to help them lose weight. Some people use some different figures. I like 80%. It's a good general kind of middle ground. And of course, none of this is set in stone for any of our patients. If they seem like they're losing weight way too fast, we adjust. If they seem like they're not losing weight, we need to adjust something different too. But helping them figure out these first steps to see how they do, remembering that of these kilocalories per day, 90% of that should come from food, only 10% from treats. And that's, like I said, for probably the majority of my clients at least, the culprit in the weight loss. So to help with successful weight loss, this is where we also, of course, need to give them all of this information. We also need to follow up and make them accountable. Have them come in and weigh Fluffy in a month to see where we're at. And okay, well, she's lost, a couple pounds. That's great. We're on the right track. Let's keep going. You guys are doing great. So lots of positive reinforcement for the owners. It can go a long way just to let them know that their hard work is being noticed and they're doing good things for their dog. This website, the petobesityprevention.org website, also has a lot of really good information for us and for owners too. So that's a good one to look for some different things. Talking very briefly about supplements and joint protectants. So we mentioned Adequin at the beginning. Adequin is a polysulfated glucosamine glycan. I have a really hard time saying that. But basically it's compound given as an injection, helps to stimulate collagen synthesis and helps to block the cartilage breakdown in the joint. AKA it helps to delay the progression of OA and keeps the cartilage healthy. It's one of the best things out there that we have to help protect those joints and kind of keep OA as far away as possible. As we mentioned with pain control, we can get a little bit of pain relief because of the effects on blocking the cartilage breakdown and therefore the inflammation that causes. The other thing with Adequin for us, we like starting this early. Start it as when there's as much cartilage there to protect and keep happy and healthy as possible. So we don't have to wait until there's bad arthritis to start this. For Willow, her joints were nice and happy and healthy when she had her amputation. She got started on this as soon as basically she was recovered from surgery, just to keep those joints as happy and healthy as possible. And little over 2 years later, she still has very minimal changes of arthritis in her remaining joints. The other things I definitely encourage for owners for their dogs, omega-3 fatty acids, a lot of research behind that. It's natural anti-inflammatory, great effects in the joints, just in the body in general. There's a specific dose for this. It's 100 mg per kg of DHA plus EPA. There's, again, more math there, but it's not that difficult. Take-home points on this, got to be patient. It can take about 8 weeks for us to really see those anti-inflammatory effects in the body. And it's one thing, because it is a high dose, we need to slowly work up to that dose over a couple of weeks. Otherwise, we're probably going to give that dog diarrhea. But speaking of, the other thing is probiotics. Probiotics are kind of an up-and-coming topic, probiotics, prebiotics, all of that in general health. We're starting to understand that there is a significant link between the gut microbiome and the inflammatory state in the rest of the body. So probiotics have been shown to help rheumatoid arthritis in people. There's evidence that it could potentially help with Alzheimer's. We have, as far as I'm aware, limited studies in dogs yet. But again, probiotics can be beneficial and very unlikely to cause any harm. So something I do recommend to most of my patients. What you will notice is missing from this slide is glucosamine chondroitin. Those are products that we are starting to recognize are really not as helpful as we thought they were a few years back. And especially starting to realize that only about 30% of dogs actually absorb enough of that material to reach therapeutic levels in the body. So I don't typically encourage owners to take glucosamine chondroitin if they are on a product like Cosequin. That's fine. I just say, hey, if we're doing that, let's upgrade to DACVECC, DACVECC Advanced. So glucosamine chondroitin is not hurting anything. I don't know if it's as effective as we want it to be, but you can keep giving it. Let's go to the upgrades where we have these other ingredients, the avocado and saponified, eggshell membrane, all the other stuff that does definitely have more science behind it. So activity modifications, this can be a big one, especially in the beginning. So you can't take a dog's leg off and then once their incision is healed, just go back to what they were doing beforehand. Too many changes are there. We talked about those. They need to adjust and basically work up to things. And it's kind of our mainstay of shorter, more frequent walks rather than one big long walk. Easier on the body regardless of the condition. We talked about how tripod endurance for standing as well as walking is a little bit lower. So we want to try to, in general, just keep walks under 20 minutes. If we're going over 20 minutes, they definitely need to work up to that and need to understand that that might not be every dog. And some dogs might be able to do it. Might be a little more wear and tear on their body too, though. When we are walking, we like to start with flat terrain, generally working up to incline, decline if able. Just, we've all walked on hills in Seattle. It works the body a little differently. It's definitely harder. Don't want to start the dogs on that. Make it easy for them. And the other sad thing is we want to basically modify some of these higher impact activities. Again, these guys are at a higher risk for arthritis in their remaining legs. And so that high impact stuff, more force in those joints, it's going to damage those joints, make them more prone to arthritis. So we want to not necessarily say they can never do them again, because this is, of course, all the fun stuff dogs love to do typically, but we just need to tweak it. So we need to change the game a little bit. Instead of playing chuck it for 2 hours in the backyard, we hand throw or even roll the ball for 15 minutes, take a break, walk around, do something a little less high impact, but still fun and engaging for the dog. Maybe take another play with the ball for 10 minutes or so. Instead of doing that once or twice a day, every day, maybe just every other day kind of thing. So playing with that activity, with changing it a little bit to try to minimize the high impact aspect of it. And then just the frequency, maybe we can go down a little bit so they can still do it. It's still fun. We just don't necessarily have to do it every day. We can still do it for 10 minutes. Doesn't have to be for 2 hours. The dog's going to have fun. And then forced breaks. Some dogs are really good when they're getting tired. They'll sit down, take it easy. A lot of dogs are not really good at that. And as parents, we would need to kind of encourage owners to say, okay, after 10 minutes, you're back on leash. We're going to just walk around, smell the flowers over here, take a little break, then we can go back and play again. It's very important when we're doing these things, especially in the beginning stages. Again, I know I keep saying that, but it's important that we watch those dogs for any signs of fatigue or pain. Any signs of fatigue during the activity, we're done. Dog's going home. Any signs of pain during the activity, same thing. But we also need to watch for signs of pain later that day, even the next day. So if he goes home, takes a nap, can't really get up after his nap, or has a hard time getting up and walking the next morning, did too much, we need to cut it back. So we need to watch for these things. If they do happen, adjust, make things a little bit easier on the dog. Ideally, we wouldn't get to this point. So that would be kind of that sweet spot of we can go do things, but avoid working to fatigue, working till we are going to pay for it the next day. Assistive devices, so it's just kind of general category for different things we can put on the dog. Harnesses are great, especially for the front leg tripods, just to help support some of that weight. Roughwear makes a great product that works really well for a dog with one front leg. Help 'em Up is also, of course, a great product. That tends to work better for the hind limb amputees I found. Braces, see Willow is sporting her dog legs carpal brace here. So that's just a simple neoprene Velcro brace. Does not wear that all the time, just at times where she's outside more or jumping around more, just basically more active. So she has a little extra support to her carpus to help kind of try to slow down breakdown of that joint. If we keep it on them all the time, we actually can weaken the support structures and cause more problems. Obviously, we don't want to do that. Carts or wheelchairs are another potential for some of these dogs that can help support them, so that especially the guys that have a really active lifestyle, it helps keep them there. Definitely not for all patients. I tried to put Willow in a cart for a while. She thinks they're the devil, will not go anywhere near them. We gave up on that. Assistive devices kind of group some foot traction options here. So especially tripods, any dog, we want to make sure they've got nice grip on their feet. So keeping these adorable fluffy toes nice and trimmed so that these paw pads can contact the ground, keeping the nails nice and short. There are some different products to go on the feet as well. Dr. Busby's toe grips are basically a little rubber ring that goes on the toenail to help increase basically a little traction. Paw friction is a product. It's basically super gluing sand on the paw pads. Not every dog will go with one, but they'll go with the other. Some dogs don't like either. Sometimes you just have to play with it and see what works for that dog. One thing I will say about the toe grips, if you have a dog with kind of fuzzy toes, those can fall off. The dogs will sometimes pull them off, no big deal. They can also get wedged up in the nail bed. So if you got these fuzzy toes, you can't really see that nail bed, just make sure you instruct your clients to inspect the feet at least once a day to make sure there's nothing stuck up there. Different home environment modifications. Bedding, we want our dogs to be nice and comfy, but the real thick, super fluffy beds are hard for the tripods to get around. So we want to try to keep things a little simpler for them to get on. Flooring and traction support is extremely important. This usually we can address with different throw rugs. Yoga mats in a pinch work great. And we definitely want to have these in key areas like food bowl, water bowl, back door, front door, down long halls, things like that. Stairs, if the dog's doing stairs, those stairs should have traction and not just be wood stairs. Carpet's the best. If we can't do that, there's various different stickers and things you can put on stairs to help increase traction there. Ideally, the tripod, especially the new tripod, would not have free access to the stairs. It would only be something you have your little handle harness on and you're there with them, helping them up and down. Elevating food bowls can be helpful, just so there's not the extra pressure on the neck and back of bending down to eat. Typically shoot for about elbow height. Ramps and stairs are great in theory to help keep these guys from jumping on and off furniture and things like that. Unfortunately, most dogs, if they're like mine, hate them and like, this is good for me, I'm not going to do it. I'm going to try to jump up over here. So that's a fun game we play in my house of, no, I'm going to make you use this today. And sometimes it works, sometimes it doesn't. We can only do what we can do. Other thing, getting in and out of the car. I see these clients bring their dogs out after our consult and one back leg and they're letting them jump into the back of the SUV. I'm just like cringe just a little bit inside. It's best, even if the dog can do it, again, doesn't mean that they should be doing it. Them jumping like that definitely increases the risk of any kind of injury to their other legs. So try to counsel owners to help your dog in and out of the car, whether that's lifting them in, getting a ramp, something like that. Then we get to some different therapeutic exercises. This is a gigantic discussion all in itself, but basically these exercises work on weight bearing, flexibility, balance, strength, eventually endurance. We always start simple, gradually progress, and when an exercise has progressed, no longer challenging, we move on to a next level exercise. The biggest thing, we always want to make this fun for our dogs. We don't want it to be punishment. So lots of positive reinforcements, lots of praise. We do use treats. If you remember, we're paying attention to my weight loss, said treats are bad because they make dogs fat. So what you can do, use low calorie treats, watch the treats you're using. What I do with my kids is I take some of their breakfast, put it in a separate thing, throw a couple higher reward treats in there, like a Zooks, and they basically get mostly kibble and occasionally more higher reward Zook in there when we're working on exercises. So the first exercise that I like with these guys is called Rhythmic Stabilization. It helps with body awareness, core strength, general limb stability. Start with a square stance, front feet under shoulders, back feet under hips, and then typically standing behind the dog usually works best. You put your hands on their hips and basically just gentle pressure, push the hip to the opposite side. The goal is to have that dog engage those muscles to kind of fight that. We don't want to push the dog over. We don't want them to step out. We just want those stabilizer muscles engaged. If the dog's kind of weak, you can use your other hand on the side you're pushing towards just to help support a little bit. This is one we can work pushing not just right to left or left to right, different angles, just to work the different muscles. And this is Miss Willow. She is very food motivated and distracted. So working here on her back leg, she steps out there. So just pull her back into a more square stance. And she honestly doesn't even know I'm doing anything to her. So just pushing from some different angles, holding. And here, because she's a front limb amputee, my hands on her tuber ischii and just pushing her forward a little bit, just because she tends to weight shift back. I'm forcing her to weight shift forward just a little bit. And this one, I'm just working on her front end a little bit. She does pretty good going to the left side. She's a little bit more weak going to the right side, so definitely needs a little extra assistance there. Cookie stretch is another one. This one is honestly one of my favorite exercises for pretty much any dog. It's great for working on balance, proprioception, helps us strengthen and stretch the cervical spinal muscles, a little bit of core strength in there. And this one, so we start again in that square stance, and the goal is taking a cookie or a treat and using it to lure the dog's nose first over to just the shoulder and then eventually to the hip. So it's basically a little side stretch. So Willow starts on the one side, she steps out a little bit, support her so she's not going in a circle. She drops her cookie and has to find it, of course, because you can't lose any cookies. And then back to the other side. So we can go to the sides like that. We can also do different angles on the neck. So this is not working great at the moment. Basically just luring her head, nose down to her chest, eventually trying to get the top of her head parallel to the ground. Pause up is another quick, easy one to start with. It helps balance core strength, limb strength, good general exercise. For this one, it's starting with a stable low surface, somewhere between wrist and elbow. The lower, the easier, higher is a little more challenging. Basically just want to get the dog to walk up to it, put the front feet on the elevated surface, back feet on the floor. They should be in that square stance with a flat back, so not arched, not sunken. And then we can weight shift, so lure them with a treat forward, push them back a little bit. We can even do a little side-to-side motion. And this is Willow. She's practiced this before, so she's on an unstable surface of the Bozu ball. And she is standing there, not quite centered, but life isn't always perfect. We are luring her forward here. So she's putting more weight shift front. On this one, pushing her back. So she's weight shifting back a little bit more. All right, lots of more exercises to talk about, but those are 3 really easy ones. I usually don't start owners with more than 3 because that's just too overwhelming and basically guarantee they're never gonna do them. So happy to talk more about that. If you want, email me. Other questions, when to refer here to sound. So if a dog has other musculoskeletal, neurologic disease, and then is missing a leg, makes it a little bit more complicated. So things like advanced OA, hip dysplasia, elbow dysplasia, previous or new cruciate rupture, other neurologic things, definitely feel free to send it to us. We're happy to work with that. Patients where they're painful, they're not easy to manage, and you just need that extra help with managing their pain, we can do that. And sometimes we have some different modalities we can do here, whether it's acupuncture and laser. A lot of other people can do that too. We also have different joint injections. We have shockwave therapy, other things we can do to help with joint disease, pain, all of that. This picture is on here. This is my friend Haley June, who is a newer tripod that was overweight and had a chronic Achilles injury on her one hind leg. So she was definitely an appropriate patient to come see sound. She is a very active dog, loves being outside, running around, and her boot would get in the way. So she wears her boot, but her people also got her this fancy little pink cart so she can have a little bit more freedom and fun outside. All right, talked about a lot of things, rambled quite a bit. Take home points. Dogs, yes, accommodate well to amputation, but things are changing. We can do more to help them. And some of those things honestly aren't that hard for us to institute. It's just knowing what to do. So considering that, and then even again, before surgery, the whole case, taking that into consideration, the entire dog, lifestyle, owner expectations, is amputation the right thing for this dog? Pain recognition and pain control, always going to be my top priority. A lot of things we can do to protect the remaining joints. It goes back to, sure, dogs can do great, but we can do more. Let's keep them moving, protect those joints. And again, the simple changes that we can do, especially for the long haul, with different activity home modifications, a couple exercises that we can make fun. Don't expect you guys to read this, but threw that in there just in case anyone's interested in some of the different references that I talked about in here. Otherwise, this is my adorable trio, Willow, my friend Brix, The black dog on the right there is Lenny. Lenny also decided she wanted to be like her sister and developed osteosarcoma. And she is now a right front tripod with me too. So getting lots of practice with the tripods. And at this point, again, my email's down there. Please don't give that out to your clients, but feel free to reach out to me with questions. And we can take any other questions that came up. Can I read them? Where do I go? Okay. Okay, technology is not my friend. All right, so one question was what dose of ketamine for the low dose ketamine? That dose is 0.5 mg per kg, so half mg per kg, sub-Q, typically once a month. Some dogs we've seen need it a little bit more often, standards once a month. Dosage of pregabalin, is it a reasonable price? Pregabalin dose, we tend to start around 2 to 3 mg per kg twice a day. It can start at once a day, but I usually go with twice. Reasonable price depends on the size of the dog. The bigger dogs that can fit the 100 milligram Lyrica size, it's pretty cheap. For these smaller dogs, it has to be compounded. It's probably going to be a little bit more expensive, but it should still be reasonable. Let's see, and then there's a question about using or avoiding Pemph therapy in dogs with hemangiosarc, electronic devices. Okay, sorry, reading at the same time and I don't have my glasses on. Question was, CC recommends avoiding Pemph in dogs with hemangiosarc, those with implanted electronic devices. Any contraindications for the Respond mat? They should be the same. It's slightly different technology as far as frequency and wavelength and all of that, but it's still electromagnetic field therapy. And definitely implanted electronic devices, pacemakers, fun things like that. Let's just stay away from those. Hemangiosarc, technically Pemph should be good for cancer. I'd have to kind of go over all that research a little bit more, but if a CC says no, I would probably say the same for the mats. I don't know if Respond has specific recommendations about that one though. Let's see, more questions. Whoa, that just scrolled really fast. Since glucosamine comes right in supplement, less likely recommendation, Adequan something you would recommend given? Yes. So the question is, since I'm not a huge fan of glucosamine chondroitin, is Adequan something I would recommend instead of an oral joint supplement? Short answer is yes. Adequan is something I always recommend. It's pretty much one of my top 3 recommendations for any dog for arthritis. And giving that Adequan, yes. Okay, this is going in, everything's moving on my screen. But that doesn't mean I'm not going to recommend oral supplements. There are some other things depending on the dog that I might recommend. It just might not be the glucosamine chondroitin. Question on stem cell therapy. So stem cell therapy, answer to that is going to be, first off, what did the dog have to begin with? If it was cancer, no. If it was trauma, something like that, that obviously is a non-cancerous type condition, and we want to do things like the joint injections for pain control, protecting cartilage, especially if arthritis is already there. Stem cell therapy is definitely an option. How long do I continue Pemph in dogs post-amputation? Kind of depends on the dog too. It's something that Willow had her amputation, it's been a little over 2 years. She still hangs out on the Pemph bed, at least a few days a week, just because she has a tendency to, even though she's adjusted to things and isn't in that post-surgery pain, she's real good at running too fast one day and tweaking something. So she might have a little soreness in her neck, one of her back leg muscles, that kind of thing. So I just kind of go on the assumption of she's probably a little sore walking around on 3 legs, being a big dog. So she hangs out there. Again, I don't think it's really going to hurt anything, and my dogs love it. My cats oftentimes will beat the dogs out of the bed, and they're quote unquote normal, they're cats, but so I think Pemph therapy is a great thing to continue long term, quite honestly. Long answer, sorry. Okay, no more open questions. I think that means we're done. All right. Thank you guys for joining me, for bearing with me, and appreciating all the beautiful pictures of my girl. Again, any questions, concerns, if you disagree with anything I said, email me, let's talk about it. All right.